Well, hello, I'm Doug Apple, back with another special interview for you today. Is this your anniversary? Well, it is an anniversary. Probably not one you were thinking about. Probably not one you were celebrating necessarily. It's the 13th anniversary of the passing of the Affordable Care Act, also known as Obamacare. And here's the headline in Forbes. It says, Obamacare Insurance 10 years on. Actually, it's the 13th anniversary of the passing of the ACA, and it's 10 years since the creation of the government health insurance exchanges. So we can step back and take a look at the big picture. I know at the time, Speaker of the House, Nancy Pelosi, when she was asked what was in this bill, she said, well, we have to pass it first before we can find out what's in it. Well, a few years have gone by now. Surely we can tell what was in it and what's happened, how it's actually affected the economy, how it's played out in the real world over these years. And so we have attorney Mike Sharman on the phone line with us. He is also the legal counsel for Share Healthcare. So he's got an involvement in the healthcare world. Share Healthcare is a nonprofit Christian healthcare sharing ministry. And we'll tell you more about Share Healthcare. They've bought some airtime here on Wave 94. You've heard their ads, but we'll get into that in a little bit. But these headlines and Obamacare, the Affordable Care Act, even Medicaid, where does that fit into all this? We're going to talk with Mike Sharman now. Give us a little historical look and give us some information that we need to know that can help us be smarter. Sometimes we get our news off of little memes on the internet. Well, we're not going to do that. We're going to get some real news from Mike Sharman. Mike, here's this anniversary. Probably not one you're celebrating, but go ahead and give us some information about what it all means, the big picture, how it played out, and maybe even where it's headed.
Thanks, Doug. And I think one thing to celebrate is Obamacare recognized that it was imposing upon individuals, employers, and the state mandate. I mean, that was the basic premise of it. And in any universal law, any law that's an omnibus law that covers everybody in the United States, there's always been a conscientious objector clause. There is in Social Security, there is in the draft. And thankfully, the thing to celebrate is that in the Affordable Care Act, Obamacare, there was a conscientious objector clause for healthcare sharing ministry. And Share Healthcare is one of those healthcare share ministries. So healthcare share ministries and the people who are members of them are exempt from the Affordable Care Act, in that a number of states just adopted the Affordable Care Act as their standard, and so their healthcare sharing ministries are also exempt from those states that still have an individual mandate and have done that. So the good news is that Share Healthcare doesn't have to do what the Affordable Care Act has said. And that's good because the Affordable Care Act had, depending on how skeptical one is, it either had unintended or intended consequences of totally distorting healthcare provision in the United States. It's distorted the healthcare profession in the United States. It's distorted the acquisition of health care in the United States. It's distorted the function and profitability of hospitals in the United States, particularly rural hospitals. Supposedly, it was about insuring the uninsured. I mean, when it was first being proposed and discussed, that was it. We have to take care of these uninsured people. But politicians only work if the voters want what they are proposing. And very quickly, some politicians, particularly Senator Chuck Schumer, recognize that the uninsured don't vote. And Forbes article that came out that you mentioned, Doug, at the top, pointed this out right in the first page there. Schumer specifically mentioned that the uninsured don't vote, and 95% of the people who vote, 95% of the people who vote have insurance. So it wasn't going to sell to them to have these mandates put upon them to give them something they already have and we're happy with. And remember, President Obama's big promise is, well, if you like your health care plan, you can keep your health care plan, which turned out to be absolutely false. all healthcare plans changed from what they were, even if they had the same name. But many of them shut down and closed because they could not function under the strictures of Obamacare. The only increase that there's been in the uninsured has been the increase in the expansion of Medicaid. Because as I mentioned, Obamacare had mandate. It mandated that the individual had to have insurance. If not, they'd have to pay this tax. That was zeroed out as soon as President Trump came into office. So the law is still there, but there's a dollar sign and a blank next to it now. But then the employers would have a mandate. And then states would have a mandate that they would have to either take on Medicaid expansion or suffer the consequences. Well, what was Medicaid for? Medicaid was designed to be for disabled people who were not yet over 65. That's what it was for. Well, as a result of the Medicaid expansion dictated to by the Affordable Care Act, that expansion was beyond the disabled. It had earlier been expanded to children, and then it was expanded under Obamacare to people at relatively high income without regard to whether they're disabled or not. So now 100 million people, 1/3 of the United States population, is in Medicaid. So we have 1/3 of the United States population in government care. Well, that would be nice if it was nice, but it's not. The problem is that, one, you don't get what you would like under Medicaid, and the healthcare providers don't get paid what they need to under Medicaid. So the result of that is that it has caused lots of rural hospital closures, and it's caused lots of healthcare providers to not accept Medicaid patients. People are not assisted. They're hurt by this. The basic market function of insurance and healthcare was intentionally replaced with what's known as a managed competition model. Well, not managed by the competition. The competition was managed by who? The government. Well, the Soviet Union collapsed because they realized that a central power, well, they hadn't realized, but it just wound up collapsing of its own weight, that a central power cannot manage the entire population across time zones, cultures, people groups, etc. It just doesn't work, and over time it will collapse. So this forced management of the competition distorted all of the competitions, and it completely disconnected the premium that an insured or enrollee with the healthcare exchanges pays and the actual risk that is imposed. A drug addict will pay the same as a person who jogs 5 miles a day, never smoked, never drank, never did drugs. That completely distorts the law of the harvest, which is the basic premise from Genesis to Revelation, but it's also just the basic premise of life, because that's the way God created it. But you don't have to be a believer in God or in the Bible to see the law of the harvest and its impact. You disconnect consequences from actions, and you're going to totally distort everything around you.
Yeah, but Mike, some people call that compassion.
Well, compassion is when you have a choice to do something about it, isn't it?
Ah, yes.
And here we have the imposition of it. We have it dictated. I mean, they were literally called mandate. They were called mandates for a reason. People didn't choose to do it. But, you know, the hospital that we have here in town that I'm in was a compassionately founded hospital. Volunteers chose to be on a board to get a hospital built. Volunteer committees chose to raise the funds to build the hospital. They did the care that they needed to, and if people could pay, they could pay. I mean, that's the way most hospitals, particularly in rural areas, began. But also think of how many hospitals have denominational names. You know, New York Presbyterian, or, you know, the St. Mary's, and et cetera, et cetera, et cetera. So compassion did exist and was able to flourish and was necessary before government stepped in. after government stepped in and told them they had to do this, they have to do that. And oh, by the way, if you just follow our guidelines, we'll pay you. If your patients can't, we'll pay you. So get on this this line that we want you to be in. Get in this line, get on the path, begin following the guidebook, what we give you, and we'll pay you. Well, that sounded good at the time, but what wound up happening is they pay not enough, and yet they dictate these things. And so hospitals that had been profitable before Obamacare, while providing compassionate care, et cetera, wound up going under. The idea sounded good, but it was uninformed. You mentioned at the top of the show Nancy Pelosi's quote, but a lot of people might think that you were paraphrasing it or joking, but what she said was literally the case. I mean, it was H.R. 1 was the name of the bill that was Obamacare. It was the first bill, H.R. 1, that came before the floor when President Obama took office. It was not released until the vote, meaning no congressman was able to see it before they voted on it. And Nancy Pelosi had literally said when she was asked about that, we have to pass the bill so that you can find out what is in it. If that's not dictatorship and elitism, I don't know what is. And we're suffering the consequences of that. The plans, the healthcare plans sold in those Obamacare health exchanges became less and less attractive. And then by 2020, which is one of the dates we can measure by, the premiums had more than doubled. Deductibles were up to 60%, meaning a patient's going to have to pay 60% more than they did before Obamacare. It just didn't work. A number of doctor visits per capita went down, even though the cost went up $100 billion. We can look at all sorts of measures and just see it didn't work. Why didn't it work? Because government was distorting the marketplace. So the Foundation for Government Accountability had done a study about the impact of Medicaid expansion. Remember, Obamacare dictated to the states, you have to do this Medicaid expansion or suffer the consequences. Well, the ones that chose not to suffered good consequences. The ones that chose to do the Medicaid expansion have had real problems. The hospitals had to make up for the shortfall in what Medicaid did not pay for their patients that came in. So Medicaid expansion was put in place. The population of people in that community of people on Medicaid went up, which meant more patients coming into the hospital were on Medicaid, which meant more patients were coming into the hospital that the hospital, if it accepted Medicaid at all, had to take. And taking that, they were losing on every patient because Medicaid's prices were too low. And so they had to do what? Well, try to get the private payers to pay more. So it became more expensive for the people who had actually had insurance. Remember, 95% of the voters at the time had insurance. That shortfall has increased by 117%, more than doubled since before the Obamacare. The expansion state, the state shortfalls have doubled from up to $13.2 billion. The states that didn't do the expansion have done well. They haven't had as many rural hospitals closed, et cetera. Their costs haven't increased to the same degree, even though healthcare expenses throughout have increased because of the different problems, distortions of Obamacare. But we can look at the problem beyond healthcare. It's real simple when we think about, well, what's the point of a government policy? What's the point of tax policy? It's to just push people into a place that the government wants, that they otherwise wouldn't go. So it's necessarily, by definition, a government policy is going to distort the marketplace. And you're going to have that distortion in one area create distortions in others. And then instead of having lots of small corrections that the marketplace does, you're going to have a dislocation of it because of the government policy that's pushing people into an area they otherwise would not have gone.
So here's a question for you, Mike, and that is, why do hospitals and doctors get paid less by the government?
Because the government sets the rate.
So why do they set it low? They got all the money in the world.
That's a good question. Why they set it that low? Because perhaps that somebody that actually is in charge of setting the prices wanted to try to keep the government's expense low. I don't know. But, that's one of the big problems with a distortion of our government itself. We were supposed to have the three branches of government that were modeling Isaiah 33:22. When Isaiah 33:22, it mentions that God is our king, God is our lawgiver, God is the judge. The three branches of government: executive, legislative, and judiciary. Well, for government, each of those are supposed to be co-equal. But the executive has morphed incredibly. And going back to your question, well, why, if the government can just print money, why is Medicaid priced so low if they could just print money and give it back? Well, because a bureaucrat or a collection of a small subdepartment of bureaucrats decide what these prices are going to be. And we never see them, but they impose their idea on all of the United States. And Medicaid prices are different than Medicare prices. Now, Share Healthcare does negotiate prices with the healthcare provider and the doctors. And we typically use Medicare prices as a benchmark, and we pay above that, which still gets our members a price way below retail. Remember, we mentioned that because of the fact they're losing money on a lot of these government programs, hospitals charge the private payers more. So their retail price is very high. And we typically get about a 60% discount off of that. That is, if it's a $100 bill, we would pay $40. And so our members are able to share at a lower rate. And for those that have been listening, they're wondering, well, okay, so Medicaid's not that great, Medicare is not all that wonderful, and the healthcare exchange plans cost people more money than they had been worth, all that. Well, what about Share Healthcare? So Share Healthcare shares its members, who are Christians, shares its members medically necessary medical expenses. And for a single, the monthly price is $149. For a couple, $249. For a family of four, it's $349, and then $50 for each family member after that. So how can we be so much less than what health insurance is? And health insurance right now for a family of four is going to have a monthly premium of about $2,200 a month. $349 versus $2,200. How can we do that? Well, remember I mentioned that Obamacare wiped out the connection between the premium and the risk. Well, with that, all the healthy people in insurance have to pay much more because of the unhealthy ones or those that are choosing unhealthy lifestyles. Well, it's those unhealthy lifestyles, which not coincidentally are also unbiblical lifestyles. Mm-hmm. And so those that are addicted to alcohol, those that are addicted to drugs, those that are addicted to a sexual lifestyle that's not biblical, well, we don't share. Those people would not be able to be a member of Share Healthcare. And so because we've taken that out as well as tobacco, bam, we're at $149 for a single, $249 for a couple, $349 for a family of four versus $2,200 for the population at large. Why is that? Because we're just simply trying to live by the Word of God. Do Christians get sick? Do they get disease? Do they have accidents? Do they eventually die? Absolutely. But on the way, they have a lot less negative health consequences because on the way, they're doing a lot less negative things to their body. And then they also have, when they are having a disease or an accident, they have people praying for them, which literally helps their healing go faster. And it's not our plan. We're just trying to come alongside and see what God's plan has been for his individual people and his body of Christ at large.
Does it look like there'll ever come a time when the government will eliminate healthcare sharing ministries?
Well, in 35 states, I think it is now, we had a couple states this year pass new laws protecting healthcare sharing ministries. But it's been 32 states for a long time, and like I said, I think it's 35 states right now that specifically have laws protecting healthcare sharing ministry and exempting them from their insurance laws and allowing them to operate as they are set up to be, as ministries. So there's 15 states, and you could probably figure out New England and the West Coast are where it's still being either neutral or being attacked. So that might be, but I don't. It seems like the trend right now among even the regulators who are antagonistic to healthcare sharing ministries, it seems like what they are looking for now, more than trying to end them, is to get more information from them and have more accurate reporting from them, so that those states can put that information up on their website, so a consumer can look at and see what they see the information that those regulators think is important to them. And that's a bother, but we're perfectly fine with being able to do that.
Mm-hmm.
I think bigger question, though, from more people, because not everybody has healthcare sharing ministry, but pretty much most everyone does have health insurance or are on a health exchange plan, is what's the future of Obamacare? What's the future of the Affordable Care Act? And even though the population, if you poll them, they tend to have a favorable view of that phrase, the Obamacare or the Affordable Care Act, because they're told over and over by the media that it is good. Almost nobody actually likes the impact of it. When they think of what's occurred with healthcare costs, which is the word, the restriction of healthcare providers, if you've tried to get an appointment with a cardiologist, a dermatologist, any doctor, you know now it's months out, where it used to perhaps be days or weeks out. Everything has gotten worse in the healthcare distribution system, let's say. So the legislators may very well look at Obamacare, the Affordable Care Act, and say, this is not working. We need to just strip this away and see what the market's going to do in readjusting itself.
Is this current election year going to bring about any big changes?
Well, it absolutely could. It depends on who we get in the House, who we get in the Senate, and who we get in the presidency. If there's a majority in the House, a majority in the Senate, and in the presidency, people who believe more in the free market working out than mandated, managed competition by the government, then yes, I think we'll definitely be inclined to see some very healthy changes. If the opposite is true, we're going to see more management of our lives, more micromanagement of our lives.
Which always seems to break up the advantages of the free market economy and the market itself doing its work.
Yes, I mean, if you look at different regulations that are being done by the executive branch right now in every different aspect, it is in very clearly and very intentionally trying to undo our ability to individually choose our prices, individually choose what goods we want to buy, individually choose how we're going to manage our business or our land. I mean, it is clearly a policy decision by the administration right now to have more centralized management dictate upon people what their view is, whether it's from a climate change standpoint, an environmental standpoint, capitalism standpoint. It is very much a centralized government ideal that's being imposed upon people right now. And that is my opinion, but it's an opinion backed up by the fact that look at the Federal Register, look at any regulation that's coming out for any one of the agencies. now and for the past 3 years. And that is the story that is occurring.
Well, you said it in one of our previous interviews. Your advice was to vote for freedom.
Yes.
We'll end it with that thought today. And that is when it comes time to go out and vote this year, think about freedom. Who is going to allow you to live the more liberty-based, normal, what we might say, American life versus the ever-encroaching power of the government? But anyway, besides all that, if you think that Share Healthcare as a Christian ministry might be the answer for you and your family and your needs, and maybe if you're tired of high health insurance premiums, you ought to check out Share Healthcare. It's a Christian ministry. It's designed to help people share these burdens of their medical expenses. And so you can find out more information by giving them a call at 1-844-SHARE-HC. Or you can find more details, do your research on their website, which is sharehealthcare.com. And for Wave 94, I'm Doug Apple.